Hello, my name is Whitney Witt, and I am the inaugural Dean of the College of Health at Lehigh University. I am delighted to welcome you to this presentation about the college and the exciting opportunities available to you. Before I start my presentation about this amazing one-of-a-kind Bachelor's of Science degree in population health, I wanted to share exciting, hot off the press news. Starting this year, the college will offer admission into an accelerated 4-1 program. In 5 years, you'll earn your 4-year Bachelor of Science degree in population health, plus an accelerated 1-year Master's degree of public health or Master's of Population Health degree. As you know, the MPH is the MBA of the health field. Please stay with me to hear more in-depth details about this exciting opportunity. Now we're going to turn to our presentation today, and I'd like to review what we're going to be covering. So I'd like to first start with the story of the College of Health. I want to then dive into and highlight for you what I believe are the key differentiators for Lehigh and what makes us unique and different, and why this is such an exciting time to join us. Then I'll talk about Population Health 101. What is population health? What does it mean? This will give you key insights into what you'll learn during your time here with us. Then we'll talk about the exciting educational programs, including our degree programs and certificates. Next, we'll talk about experiential learning opportunities and some of our key research activities that will allow you to get involved in this exciting interdisciplinary research. Then we'll talk about career opportunities and what you can do following your degree program. The College of Health team welcomes you, and we will share with you and introduce you to the team of senior staff and faculty who you will be working with during your tenure here in the college. So let's get started. Under President John Simon's leadership, Lehigh in 2016 embarked on a bold plan to expand the university's impact on its students, its community, and the world. President Simon's Path to Prominence strategic plan grows and diversifies student enrollment, invests in faculty to broaden Lehigh's academic footprint, reimagined some of its iconic buildings, and created the College of Health. Next slide. The College of Health aligns with all of the aspects that make Lehigh so unique. First, experiential learning. Lehigh students contribute significantly and eagerly to the university's mission of answering questions that matter. Lehigh students collaborate on important real-world focused research under the supportive guidance of faculty. Both undergraduate and graduate students are offered the chance to contribute towards solving real-world problems through organized research activities with faculty and external partners. Lehigh's dedication to personalized academic experience supports students in a meld of courses from historic, distinct disciplines such as STEM and the humanities into a learning process customized to individual student interests and ambitions at both the undergraduate and graduate levels. Rigorous academic programs like the ones in the College of Health have an ideal student to faculty ratio and access a variety of opportunities for interdisciplinary study and provide the ideal environment for Lehigh students to design their own major, explore personal interests, and pursue degrees in multiple disciplines of applied science. The interdisciplinary research focus provides fertile ground for faculty to conduct convergent science in population health. Creative inquiry is another defining principle that Lehigh promotes. Lehigh offers a variety of opportunities for College of Health students and faculty to pursue intellectual, creative, artistic pathways that lead to transformative new innovations, expressions, and questions. And then finally, entrepreneurship is another central principle that Lehigh University ascribes to in this kind of mindset. Entrepreneurship at Lehigh teaches students and faculty how to become successful innovators, frame problems as opportunities, and develop creative solutions. College of Health students will be able to complement their degree or certificate with an entrepreneurship mindset through a variety of innovative programs and opportunities, some of which include the Baker Institute for Entrepreneurship, Creativity and Innovation, the Entrepreneurship Minor, Global Entrepreneurship Internships, the Silicon Valley Experience, and Benjamin Franklin Technology Partners. Lehigh's award-winning Technical Entrepreneurship Capstone program is another great opportunity and gives juniors and seniors and graduate students in engineering, business, and the design arts and health the opportunity to work in interdisciplinary teams with different partners. Next slide. So why the College of Health? Why are we starting a college? Why have we embarked on this bold endeavor, and we now have enrolled our first class? So despite advances in medicine and public health, significant inequities in health persist, and they are growing and emerging health problems around the globe. We want to train a workforce who is able to address critical and emerging health issues. The global pandemic, COVID-19, underscores the importance of leveraging data to improve the health of millions of people at a time. Health crises like COVID-19 are precisely what the faculty, research, and the students will learn about. Next slide. In 2013, the United States spent far more on healthcare than many other countries. Higher spending was largely driven by greater use of medical technology and higher healthcare prices, rather than more frequent doctor visits or hospital admissions. In contrast, US spending on social services made up a relatively small share of the economy relative to other countries. Despite spending more on healthcare, Americans had poor health outcomes, including shorter life expectancy and a greater prevalence of chronic conditions. Next slide. So let's talk about the spending mismatch between health determinants and health expenditures. What this slide shows is the spending mismatch between what are the fundamental causes of health and what we spend on health. As you can see, a large majority of health is determined by our environments and our behaviors. 6% of the production of health was attributable to medical care or access to medical care. This, of course, is in sharp contrast with our spending. Almost 90% of our national healthcare expenditures are spent on medical services rather than on prevention. Next slide. So I want to now talk to you about the vision and mission of the College of Health. The College of Health at Lehigh University is recognized and will be recognized as a local, national, and global leader in population health. Our vision is improving health for populations and communities through science, innovation, and action. Our mission realizes this vision through excellence and innovation in education, research, and service. Next slide. So the key differentiators for the College of Health are that we are the first institution in the world dedicated to advancing population health with a focus on health innovation and technology. We are the first institution in the world to offer undergraduate, graduate, and executive degrees and certificates in population health with a focus on health innovation and technology. We are very responsive and very, very flexible to addressing emerging problems that we see in the world and trying to find solutions. As such, we are therefore very focused and responsive to the trends and workforce needs. Next slide, please. So what makes Lehigh's College of Health so unique? We will have the first Department of Health Innovation and Technology. Experiential learning and real-world experiences are embedded in our curriculum. Research opportunities with domestic and international partners are central to our faculty's research and our students' educational experience. Active mentorship and advising will be received by the students from our core College of Health faculty. And you are part of the inaugural class of 2025. You're going to help shape the path of the college, along with our first cohort of 2024 and our inaugural faculty. We'll continue to develop our postgraduate education programs at Lehigh and partner possibly with another institution. Next slide. College of Health students are the leaders of this new burgeoning field of population health. It carries with it a responsibility in building Lehigh's pioneering strengths and applying them to health and health equity. This involves convergence science, it involves experiential learning, and it gives students the opportunity for creative inquiry and to explore their pursuits possibly in an entrepreneurial way. We're pushing the boundaries of what's currently being done, and we want to go further. We want to imagine the jobs of tomorrow. So we are encouraging our students to color outside of the lines, to think big, think about the moonshot. That's part of their education. Next slide. So let's now talk about Population Health 101. Next slide. Population health is a convergent science. So what does that mean? It means that it's interdisciplinary. It includes components of different disciplines and brings together not only the substantive knowledge, but also the methodological approaches of each of those disciplines. So it includes components of epidemiology, psychology, sociology, economics, political science, engineering, environmental health sciences, and biomedical sciences, to name a few. There's a growing need to train data scientists in health, and Lehigh, again, is the first university to heed this call. Through the power of data science, students stand to make a significant impact on the health of millions of people through this convergent science. Next slide. Now we are going to watch a video called The Tale of Two Zip Codes that will help deepen our understanding of population health.
What determines how long we'll live? Is it what we do? Is it who we are? Actually, when it comes to predicting how long you'll live, your zip code is more important than your genetic code. Here's how this works. Meet Deb and Maria. They both have jobs, they're around the same age, they're both married, and they both have 2 kids. Deb lives in A town, while Maria lives in Bville, less than 1 mile away. They're similar in so many ways, but here's the thing. On average, residents of Bville will die more than 15 years sooner than the residents of A town. Why? Because where you live is about more than just your address. It's about your opportunities. For example, Deb and Maria's access to healthy options is really different. In A-Town, Deb's family is surrounded by healthy food options, including farmers markets, specialty shops, and grocery stores. The air in A-Town is cleaner and fresher, and there are lots of safe, clean parks where Deb can exercise and her children can play. A-Town has good public schools for Deb's kids and easy access to emergency and preventive health care. On the other hand, Beeville has broken, badly lit sidewalks, and the parks are unsafe. The air is filled with truck exhausts from the nearby highway. And for food options, Maria's only choices are Beeville's many liquor stores, fast food places, or convenience stores. The schools in Beeville are overcrowded and undersupported. And even if Maria can get her kids into better schools far away, she needs to figure out how to get them there without access to a car. So for Maria, having to juggle so much to find healthy options can be an overwhelming source of chronic stress, which is a serious health risk factor. In fact, for all the residents of Beeville, chronic stress drives health problems like obesity, diabetes, asthma, and heart disease. How did A-Town and Beeville get so different? Well, in many cases in cities and towns across California.
Okay, so let's now return to the slides, if we may. So one of the key conclusions from this video is that zip code is more important than your genetic code. Let that sink in. Health matters in terms of where you live. Health matters certainly in terms of genetics, but health is impacted by a high quality and access to food, education, housing, jobs, parks and recreation, clean environment, and medical care. And what we also learned from the video is that discrimination plays a significant role where people live. And as a result of that, that can create chronic stress. The United States ranks actually 43rd in the world in terms of life expectancy. That is staggering considering the resources we have available, and yet we're not spending money on things that might prevent chronic conditions. So in the next slide, I want to talk about population health and public health. A lot of people talk about both, and there's a distinction that I think is important. In public health, we are mostly talking about vaccinations, health promotion programs, and healthcare interventions that are designed to improve the health of the public. This is typically administered by a health department or a local health organization. In contrast, population health is really about the investigation of the multiple determinants of health from cell to society. So everything from your biology all the way up to environmental factors. These studies from this research inform public health, and it contributes to improve the health and quality of populations. Population health is a data science in health. So we are part of public health, but we do the data science in health piece that informs a lot of the public health interventions and vaccination programs and other health promotion activities. Next slide, please. So strictly speaking, population health is defined as the health outcomes of a group of individuals, including the distribution of such outcomes within the group. So there are three main components to population health. We care about the outcomes of people's health. We also want to know what are the determinants of their health. And then what are the policies that may affect health? And this serves as an organizing framework for us to align and integrate a care delivery system with broader health and social systems that contribute to health. Next slide. Now I want to tell you a story about a kid named Jason. And I think this story will help illuminate what it is that you will be studying when you come here and join us in the College of Health. I want to talk about a kid named Jason who ends up in the hospital. In population health, we ask the question why. So, why was Jason in the hospital? Well, because he had an infection in his leg. But why? It got infected. Okay, well, but why? Because he was playing in a junkyard and got his leg cut by jagged steel. But why? The neighborhood was run down and kids had no supervision and there were no playgrounds. But why? His parents can't afford a nicer place to live. But why? His dad is unemployed and his mother is sick. But why? Because his dad had little education and he can't find a job. But why? So we try and get at the fundamental causes of health. Much of the work that we do and we concentrate on right now is downstream. It is way downstream. When people already have symptoms, they're going to the doctor, they're having surgeries, they're getting medications. If we were to go up that river and try and understand that path of how did they interface with the healthcare system to begin with, then we might have a chance to improve health before they ever need health care. So this is one of the most important tenets of our field, is the understanding of the importance of prevention and upstream interventions. Next slide. Now let's talk about our educational programs, including degrees and certificates. Next slide, please. Okay, so in 2020, we launched the undergraduate degree. We have our incoming inaugural cohort, just started in August, the Bachelor's of Science in Population Health students of 2024. We also have a number of certificate students, students who are getting certificates in population health, and we have a second one this year, a certificate in global population health. And then I'm very excited to share that we will be bringing on the master's and doctoral and some of the executive educational programming next fall. So as I mentioned earlier, we will be launching a 4-1 program next fall. So you are eligible for that dual degree, and we are doing a direct admittance. In other words, you would find out if you were admitted to both or one and had the opportunity to apply again to get the master's. So we'll have the Master's in Science and Population Health, the accelerated program that goes with the Bachelor's of Science. We'll also have a 2-year Master's of Public Health program that will be both on site at Lehigh and remote, completely online. In addition to the MPH, we will be launching the Masters of Science in Population Health. And you also would be it would be available to you to do a 4-1 with that master's program. We will again have on-site Masters of Science in Population Health, and we will also offer this degree online, completely online. And then we're very excited to launch our Doctoral of Philosophy and Population Health program. And we may have specialized doctoral programs in the future, like a Doctor of Health Policy and Politics. So we are definitely looking at ways of innovating our doctoral program and our doctoral offerings to focus more on the most pressing issues of our time. And we'll be launching some of our executive education programs, including graduate certificates. And we're exploring a number of different degree programs that we're hearing from our partners about needs for executive education in different areas like clinical informatics. Next slide, please. So let's talk a little bit more about this 4-1 program. It's the BS in the MS or the MPH program. We're going to focus on the MPH program. Qualified accepted students may be admitted directly into the MPH program. Again, it's 1 year. Allows students to earn both of the degrees in 5 years instead of 6. Students apply to the College of Health and indicate an interest in the 4-1 program. The process then includes an additional essay question and interview with College of Health faculty. Your acceptance will be announced in April, along with your acceptance to the BA to the BS degree. Students must maintain a GPA of 3.0 throughout their tenure in the BS program to maintain their status of admittance into the MPH program. And not all of the work, but some of the work, I think it's about 6 credits towards your MPH may begin during your senior year. Next slide. So let's talk about the departments and concentration areas. I'm so excited to share this with you because it's just incredibly innovative. We have a number of different concentration areas that students are going to be able to take a deep dive into during their junior and senior years. So those areas include epidemiology and biostatistics, community health, environmental health, our first Department of Health Innovation and Technology in the world, global health, social and behavioral health, health policy and politics, and indigenous studies. So what are the core courses included in the Bachelor's of Science in Population Health? You're going to take a suite of courses that will really give you the foundation that you need to then go into those concentration areas we just talked about. So the Introduction to Population Health. This is a course that's just fundamental. It will take us through how we define population health all the way through the translation of population health findings into practice. You'll have a course on research methods and application. There'll be a number of different seminars in population health. And we'll talk about the history of population health. What is the evolution of this field? And how does it fit within this larger field of public health? And what are some of the key historical moments in our larger field of public health? You'll also get training in the biological basis of population health. So not only will you be learning about particular outcomes, you will be learning about the biological phenomenon that create those particular outcomes. So you'll understand the biology. You'll have a capstone experience, and that could be so many different things. It could be a paper, it could be presenting at a conference, it could be a patent, it could be a presentation to the community. It could be a community-based participatory study. So it's very, very flexible, but we really want you to take your experience working with the faculty and partners and the community as an opportunity to really shape a capstone experience that's going to really be very targeted to your particular interests. And then you'll have a 1.5 years of population health data science. You are going to know more about data science than any undergraduate out there in the health world. And then finally, epidemiology, which is at the core of population health. So we have a number of current undergraduate certificates. Those include the Global Population Health Certificate along with the Population Health Certificate. We have a number of planned undergraduate certificates, very exciting. An LGBTQ and health certificate, a certificate in Indigenous Studies, and a certificate in maternal and child health. So let's talk about the experiential learning opportunities and research initiatives. So as you can see from this slide, the College of Health already has a very wide and very impressive footprint around the world. So the red stars represent the places where we actually, our faculty already have established partnerships, or we have partnerships through our colleagues in the Office of International Affairs. And then the blue stars represent places where we're developing partnerships. So I was just in India this earlier this year, and I was there to explore partnerships that would enable our students to be able to go and study with luminaries in the field, the Gates Foundation, private sector organizations, consulting firms, governments, within India. So it was very, very exciting. So you can already see that we have a very large footprint. I would say where we have the most going on is in Latin America. Dr. Ed Gomez, who you'll hopefully, when you come here, you'll be able to take many classes with him, but he's doing some very incredible work in Latin America. And more of our incoming faculty have been interested in working more in Latin America. Okay, next slide, please. So one of the things that's so unique about our degree is that we focus on health innovation and technology. And one of the things that you're going to learn about is how artificial intelligence tools can be used to improve health outcomes. So, for example, we may have a number of different pieces of information that we're working with. We're getting inputs like vital signs from patient monitoring systems. We're getting PDF files from unstructured patient data or clinician notes. And then we're getting clinician teams' decision-making and actions through observation, through video. How do we put these things together in a way that can be used to help inform clinical guidelines, protocols, and recommendations? These are very, very powerful tools. And this is in the healthcare setting. And you can imagine how artificial intelligence might be used in other settings, in social services, around the world in resource-limited settings. So it's not limited to healthcare, but to include health as well. Next slide. So I want to tell you about the research resources in the College of Health. We have a number of exciting resources that are available for our faculty to do their research, and as an extension, certainly you all will be able to do research with these resources as well. And these include the Population Health Data Warehouse. The Population Health Data Warehouse is essentially a number of different data platforms that include data that's been linked to other pieces of health information. So for instance, we have a data set now called the Early Longitudinal Birth Cohort, or ECLSB, that we have linked to a number of social and environmental determinants of health. And in this warehouse, we're able to do a number of really amazing nationally representative studies to look at the effects of where kids live and how that affects their health. So that's one example of one of the data sets in the data warehouse, but you can imagine many, many different data sets that look at molecular determinants all the way up to policy. We'll also have an artificial intelligence and data visualization lab where the possibilities are endless. Students may be interested in looking at virtual reality to study implicit bias in healthcare, or perhaps reading non-structured or unstructured data using natural language processing to better understand the impact of health policy on health outcomes, or even using data to track the path of the global pandemic, COVID-19, using data visualization. We'll also have a survey research lab. Much of the work that we do is we also assess people's health from their own perception, so subjective views of health, and also reporting symptoms, reporting what their environment is like. So having the person who we're working with and studying really involved in understanding health from their perspective subjectively is so important. We'll also have a design thinking lab that will certainly dovetail with many of the other colleges around campus. We'll have a community partnership engagement space. One of the things that's so wonderful about the College of Health is that we're building this new building that you see here in this photograph. This is the Health Science and Technology building, which is where all of these research resources along with the College of Health will be located. It will be opening in fall of 2021. So when you all arrive, this building will be here. And we'll be able to actually have a space in this building where we will be able to engage with community partners around community-based participatory research. So we will have an allocated space specifically for our partnerships with the community. And we also plan to have open wet and dry lab space in this building. So very exciting resources that are available. One of the things that's so important to me as the dean is that students who come here as undergraduates get the experience of doing hands-on research, hands-on data science. And we're really trying to flip the educational models so that undergraduate experience is very much like going to graduate school, where you work really closely with your professors, you have a lot of mentorship, you're very close with your cohort, and you do a lot of collaborative work together. You get out into the community, you get out into the world to study things on your own and to come back to us and use us as a resource to help guide you in your tailored education. So, it's a great opportunity. Next slide. So a little bit about the Artificial Intelligence and Data Visualization Lab. It will certainly showcase the technology that we have available. It will also bring the newest tech from labs to the actual end users. So that will be available to you as well. We'll offer instructional and consulting services to certainly departments around campus, other colleges, other organizations that are interested in AI and data visualization. We'll support the development and evaluation of health innovation and technology. Some of the most exciting work in health is happening using AI. The treatment of autism is actually kids are using virtual reality to learn about how to interact socially, and how to do that in a way that feels comfortable to them. So artificial intelligence is being used in some very important ways to improve the health and lives of children and adults. Next slide. So a little bit more about the Survey Research Laboratory. This is really, again, as I mentioned, we want to know more about the people who we are collecting quantitative data on. So this fuels primary data collection from focus groups, face-to-face technology-assisted interviews, and remote data collection via telephone or internet conferencing. We also will serve, the faculty, students, and project staff for rigorous qualitative mixed methods and quantitative survey-based data collection, and assist in development of and deployment of essential data collection tools. So we will serve as sort of a repository for all of these things in the lab. We'll also have a design thinking lab, as I mentioned, and this is really to foster the spirit of convergence and to help move health innovation and technology insight into impact. And so we will actually house this design thinking laboratory in the HST. The space will support and inspire transdisciplinary interactions among Lehigh faculty, students, and stakeholders and external partners for design thinking processes and creative problem solving. As I mentioned earlier, we will have that community partnership engagement space. We are actually holding a community health summit this spring to better understand the needs of the South Bethlehem community, and to take that information and work with community-based organizations to design interventions that will help them improve the health of their own population. So this is called community-based participatory research. So we help with the research, we help with helping the community understand how to ask research questions, evaluate those questions, collect data, and then interpret those data, and then turn those results into practice. That's what we do with them. So very exciting. So what about career opportunities? What can you do with this degree? Well, wow, the world is going to be your oyster. There is a very high demand for data scientists in health right now. In fact, there have been several reports that have come out, one in 2016 from IBM, showing that jobs specifying in clinical data analysis increased by 54% and is expected to continue to increase. The need for clinical data health system specialists are said to be increasing by 24% by 2020 this year. And the National Institutes of Health even came out and recently announced that one of their core goals is to enhance the workforce development for biomedical data science. So there are calls from many different sectors to really increase the workforce because they're seeing that there's going to be great demand for these skill sets. Next slide. So just to top this off, to give you an example, in 2019, United Health Group, which is one of the largest health plans in the country, made a 5-year, $8.25 million investment to help train data science and analytic experts at 4 historically Black colleges and universities. United Health estimates that the job openings for data experts in the US will exceed more than 2 million in 2020. So they are seeing, they're one company, and they're already seeing the demand for these kinds of skill sets, and they're investing in it. So one of the things you might not know is that 30% of the world's stored data comes from the healthcare industry. So of the approximately 6,000 data scientists in the US, only 180 of them work in healthcare. So you can imagine the demand that's pent up. Many organizations are very interested in analyzing these data, but just don't have the people power to do it right now. So healthcare could actually use 10 to 20 times more data scientists. Next slide. So here I wanted to show you just how many startups are coming about as a result of population health and data science and health. So these startups are really transforming healthcare using artificial intelligence. So what they're doing is a lot of them are gathering information outside of healthcare, using wearables, using other kinds of devices in the home to collectively get a sense of what's happening in terms of people's health before they go to the healthcare system, and actually using that information to communicate with their healthcare provider about their health in real time, so that their healthcare provider can give them direct input about whether or not they should seek care. Next slide. So when we look at this globally, we see that the workforce in 2018 and 2022, this was a profile that was recently done. It's called the Future of Jobs Report. And what we see emerging in 2018 is data analysts and scientists, big data specialists. These are the people we are training. So those kinds of jobs are just going to go up. So it's 8% in 2018. It's expected to go up to 22% in 2022. And this includes a lot of other disciplines as well. And then you can see over on the right-hand side, there's a reduction in a number of different areas. So you can see in contrast, this field is growing. So where can you go with this degree? Well, you can go pretty much anywhere. In the private sector, consulting firms are very interested in students with expertise in data science. Health tech companies are very interested in working with students with these kinds of skill sets, because a lot of them have health information and need students to be data architects, to link data, to analyze it and interpret it. Certainly pharmaceutical companies will continue to need data scientists as they have for some time. But I think the need is changing in big pharma, in that it's not just the data that they collect, but they're recognizing an increased importance in being able to link their data to the social and environmental determinants to better understand the context in which people are living in. Nonprofits. This is not something you would necessarily think, aha, nonprofits, but professional societies like the American Heart Association, the American Cancer Society. All of these professional societies, or many of them are disease focused or population focused, they're all sitting on data. They collect a lot of information about the constituents that they are advocating for. And they don't necessarily know how to link it to other pieces of information that may be very, very helpful for the quality of life and the quality of care for their constituents. Certainly many of our students will go on to medical school. They'll go on to get an MPH. They'll go on to get a master's or PhD in population health. They may go on into engineering, computer science, but definitely academia is a place where people can land, and they may, if they go the PhD route, may be interested in actually joining the faculty somewhere to teach population health. Government, there is a desperate need for data scientists in government at every single level. I'll give an example of the need at the state level. I've seen states that do not have data scientists to the extent where they have had to rely on outside consulting firms for statistical analysis, for interpretation of things like the neonatal abstinence syndrome. Something, that there is a great need for data scientists at the state level, and they just haven't been able to afford them necessarily. And so, because much of the training of population health happens, at the PhD level. So there's a great demand, certainly at the state level in Medicaid, but also federally. There are a number of different federal arms that do research and are always looking for people who have expertise in data science and health to better inform policy. Internationally, I think the sky is the limit here, because countries are really sitting on mounds of data that have never been analyzed, some of them, and certainly not linked to other data sources that could be very beneficial to them in understanding the root causes of health. Much of what we know globally comes from some wonderful organizations around the globe. However, the information is very very basic. It doesn't include some of the contextual factors that may really help us dig down into what are those root causes. Next slide. Okay, last but not least, let me introduce you to the College of Health team, the faculty and staff. As I introduce myself, I'm Whitney Witt. I'm the inaugural dean and professor. I have expertise in maternal and child health. Jeannie Cassis is one of our senior administrators. She's an executive assistant in the College of Health. Sherry Buss is our director of administration, and she runs the college. She is amazing. Heather Messina is a senior contract specialist and grant specialist. She actually just joined the team, and she really is wonderful. She helps students and faculty with submitting grants and contracts, and tries to find funding for our faculty and students. Sean Daly just joined us as a professor of practice, and he does a lot of wonderful work in sociocultural anthropology, and specifically studies smoking cessation in Native American populations. Dr. Hyunhyuk Choi is an associate professor in environmental health, and she studies air pollution, and particularly during the perinatal period. And she's done some very exciting work in the Czech Republic and in China, and she's actually bringing much of her work here locally because we have a higher incidence of respiratory illness in the Lehigh Valley. So she's looking at air pollution here locally now as well. Thomas McAndrew is an assistant professor in biostatistics, and he is our professor teaching you data science. He is absolutely wonderful. He actually contributes data to the Centers for Disease Control for all of the COVID-19 tracking. So he is doing some very cutting edge work. Dr. Ed Gomez is our director of the undergraduate programs, and he's an associate professor in and he has expertise in political science. He does really very compelling work around the politics of health. So he's someone you'll really you'll know well, particularly because he's the director of the undergraduate program. Dr. Fatima Wakil is the director of our graduate program and an associate professor. She has an amazing body of research in maternal and child health, particularly around resilience among pregnant women and its impact on outcomes. And Dr. Chris Daly is a professor here in the College of Health, and she is a medical anthropologist. And she does amazing work with the Native American population and has, along with Dr. Sean Daly, done some seminal work around smoking cessation among Native Americans, and is interested in actually expanding much of her work to other parts of the world. And then Halcyon Skinner, he's an associate dean for research, and he's also an associate professor. He is a card-carrying epidemiologist, and his work has been in molecular epidemiology, particularly trying to understand the causes of cancer, looking specifically at vitamin D and its role in pancreatic cancer. He found an association there that was published in the New York Times and in a peer-reviewed journal. So we have an amazing team. They are so dedicated to our students and so excited about the next cohort of students who are going to be coming in with, I know, the passion and the intellect and the drive for, health and social justice. So we're so excited for you to join us. Next slide. So if you have any questions or want more information, you can go to our website at health.lehigh.edu, or you can email us at ncoh@lehigh.edu. And certainly you can call us at 610-758-1800. And I just want to end things with saying it is a great honor to talk with you today, and I really hope you will consider the College of Health at Lehigh University. It's a very exciting opportunity and one that I hope you will take very seriously. So please reach out with any questions, and thank you so much for your time today.